candidate is assessed for the practical exam, all right? Now, in order to pass the practical exam, the candidate has to pass 7 clusters, okay? On the clinical skills day, you have 5 clusters. On the technical skills day, you have 2 clusters, okay? Now, with respect to the clinical skills day, the first cluster you have is clinical information gathering. This cluster contains 2 stations, which are communication OSCE station. Then you have the second cluster, which is the diagnosis and management planning. This cluster has 2 stations, which are communication OSCE station. Then you have clinical treatment and evaluation. This cluster has 6 stations, 2 communication OSCE station and 4 technical OSCE station. Okay. Then you have the communication cluster, which is basically judged during the 6 communication OSCE station that you have. Then you have an infection control cluster. This cluster is judged during the technical OSCEs, the 4 technical OSCE station you have during the clinical skills day, as well as the entire technical skills day as well. All right. So 5 clusters in the clinical skills day: clinical information gathering, diagnosis and management planning, clinical treatment and evaluation, communication, infection control. So these are the 5 clusters that the candidate needs to pass during the clinical skills day of the exam. On the technical skills day, you have clinical treatment and evaluation restoration based cluster, and then you have a preparation based cluster. So you have 3 tasks in each of this cluster, and you need to pass both these clusters to pass the technical skills day of the exam. All right. We are going to go through the assessment process that the ADC has explained in the ADC assessment process handbook, and you will get a better understanding once we start going through it. All right. Now, if you see this clinical skills day result card, which is a sample result card that the ADC has in its ADC assessment handbook. So it's just for the understanding of the candidate. Now, if you see over here on the clinical skills day, you have 10 stations, right? Station 1 and 2 belongs to cluster 1, which is the clinical information gathering. This candidate failed station 1 but passed station 2. But because he didn't fail station 1 badly and he performed really well in station 2, so he overall passed this cluster of clinical information gathering. All right. Let's look at station 3 and 4, which is diagnosis and management cluster. The candidate passed both the station, so he passed the cluster as a whole. Now you have the third cluster, which is clinical treatment and evaluation. All right. This cluster has 6 stations. Okay. Station 5 and 6 are communication OSCE. Station 7, 8, 9, 10 are technical OSCEs. The candidate failed station 7, which is the technical OSCE, but because he passed the remaining 5 stations in this cluster, he passed the entire cluster as a whole. All right. Now let's look at cluster 4, which is the communication cluster, effective communication cluster. Now this cluster is judged during the first 6 stations, which are the communication OSCE, right? So the candidate performed well and he passed this cluster. Then you have cluster 5, which is infection control. Now, infection control is judged during the 4 technical OSCEs, which is station 7, 8, 9, and 10, and as well as the technical skills day, the entire day of the technical, all right, where you need to perform 3 restoration-based tasks and 3 preparation-based tasks. So the candidate did well and didn't make mistakes with respect to infection control, didn't have any violations with respect to infection control, so he passed the cluster 5, which is the infection control as well. So overall, on the clinical skills day, the candidate did well and passed all the 5 clusters. So he passed the clinical skills day as a whole. All right. Now let's look at the technical skills day. All right. So over here, this particular candidate, the first 3 tasks which belongs to the restoration based task. The candidate failed one of the restoration based tasks but passed the remaining 2 restoration based tasks. So overall, he passed the restoration based cluster. Then the preparation based task, you have 3 preparation based tasks. The candidate failed one of the preparation based tasks, but because he did well in the other 2 preparation based tasks, so he passed this cluster as well. So he passed the technical skills day, he passed the clinical skills day, so he passed the entire exam as a whole. Okay. Now, what is an important thing that you need to remember is that because your cluster contains 2 or more station, all right. For example, the cluster 1 clinical information gathering contains 2 station, cluster 2 diagnosis and management planning contains 2 cluster, cluster 3 clinical treatment and evaluation contains 6 station, and then you have technical skills day. On the technical skills day, the restoration based task contains 3 tasks, the preparation based cluster contains 3 tasks as well. So it's not necessary to pass each and every station or task. All right, as you can see over here, this candidate failed 1, 2, 3, 4. All right, and he still managed to pass the exam, which means out of the 16 stations or 16 tasks, 10 on the clinical skills day and 6 on the technical skills day, the candidate passed 12 out of 16, and he still managed to pass the exam. Now, there is something important here that the candidate needs to remember is that it's not necessary for you to pass each and every station. Now, let's look over here. Station 1, the candidate failed. Station 2, the candidate passed. So, the total score for the first cluster is, the combination of the score in both the station 1 and station 2. So your score for station 1 and station 2 are added, and then if your total score for these 2 stations is above the minimum score that the ADC has set for this cluster, you will pass the cluster. If the combined score of station 1 and station 2 is less than the minimum score that the ADC has set for this cluster, you will fail this cluster. All right. So it doesn't really depend on one station only. Both these stations act together and the total score is generated for this cluster combining the individual score of station 1 and station 2. Now, one more important thing that you need to remember is that this candidate failed station 1, all right, but he didn't fail the station very badly. And he passed station 2, either just passing it or passing it with a good score. So because this candidate didn't fail station 1 very badly, he was compensated for a good score in station 2. But let's say if the candidate did really bad in station 1, your good score in station 2 might not be sufficient to compensate for the bad score you had in station 1, and you might fail this cluster despite failing one and passing one. So again, some candidates, when we see the candidates, when they show us their result card, candidates having similar result, like they have station 1 fail or station 2 pass or station 2 fail and station 1 pass, but some candidates pass the cluster as a whole and some candidates don't pass the cluster and they fail the cluster. Now, some candidates ask us, why is that? The reason behind that is that you cannot fail a station very badly, because if you fail it very badly, your good score in the next station will not compensate for it. Now let's give you a numerical example, okay? Because ADC mentions that each task is marked on a marking rubric and the score for each station or task is out of 45. Now let's see this example. Let's keep this example in mind and let's discuss, all right? Let's say the candidate out of 45 scored 30 in station 1, okay? And out of 45, he scored 40 in station 2. So that's total of 70, right? ADC has set a par score of, let's say, 68 out of 90 to pass this cluster. Because this candidate scored 70, he will pass the cluster, although he failed station 1. Now let's keep an example of another candidate. Now one candidate, he scored 25 in station 1 out of 45, and he scored 40 in station 2 out of 45. Now this candidate total score is 65 out of 90. Like I mentioned just now, ADC has set a par score of 68. So this candidate will fail the cluster. So now you see the difference between the two candidates. The first one, although he failed the station 1, but he didn't fail it badly, so his score was compensated for the good score in station 2. The next candidate, he failed station 1 as well, just like the first candidate, but he failed it badly. So the good score in station 2 was not sufficient enough to compensate for the very bad score in station 1. So the candidate failed cluster 1. Okay. Now this same principle or this same calculation is done for all the other clusters as well. For example, in cluster 2, you have 2 stations. Again, the scores of the 2 stations are added. In cluster 3, you have 6 stations. Again, the score of the 6 stations are added, and you come up with a total score of the cluster. And if it is above the bare minimum or the minimum score that the ADC has set to pass that cluster, the candidate will pass it. Otherwise, the candidate will fail it. Now, with respect to technical skills day, there is something very important that I want to, discuss, is that you see over here, this candidate, let's say station 1 was composite restoration, or task 1 was composite restoration, task 2 was amalgam restoration, task 3 was provisional crown restoration. Okay. Now the candidate failed the composite restoration, but he passed the amalgam restoration and the provisional crown restoration. But he didn't fail the composite restoration very badly. So the good score in the next 2 station or task, which is amalgam and provisional crown restoration, was good enough to compensate for the fail in the composite restoration. So the candidate, despite failing the composite restoration, passed the restorative cluster. What thing or what information that the candidate should learn from this is that even if you are failing a station or a task, you should try to make sure that you don't fail it badly. Let's say this candidate, like we are just giving you examples, all right? Let's say this candidate failed the composite restoration, okay? And he failed it not very badly. So his score got compensated for the next 2 tasks in the restoration based cluster. Now let's say there was another candidate who failed this composite restoration very badly. He didn't fulfill most of the checklist or the marking rubrics for the composite restoration, and he failed it very badly. Now despite passing the amalgam restoration and the provisional crown restoration, the candidate has a good chance to fail the cluster as a whole because he did very badly in task 1, which is the composite restoration. So he was not compensated for it by the good performance in the next 2 stations or task of the restoration based cluster. Okay. Now what I want to tell you here is that even if you are failing a task, for example, you are doing a composite restoration or an amalgam restoration, and you don't have enough time, and all of a sudden you notice that your cusp height is not in the proper position or its height is not appropriate. Now, even if this happens, try to make sure you don't give up on the task. What I mean by that is, if you look at the marking rubrics, okay, for each task, which is there in the ADC Practical Examination Handbook, if you look at the marking rubrics, you have 15 points on which you are judged for each task. So the cusp height or position is 1 point. You have other 13, 14 points to satisfy. So even if your task doesn't satisfy one particular criteria, make sure it satisfies the other criteria. For example, in a restoration composite or amalgam, your cusp height is not proper or is not properly positioned. You still have a lot of score to gain from that task. For example, You can gain a good score by having a good contact. You can gain a good score by having a good marginal ridge height. You can gain a good score by having no porosities. You can gain a good score by having a smooth tooth restorative junction. You can gain a good score by having no, overhangs. You can gain a good score by not damaging the assessment or the adjacent tooth. So you have so many points to gain score. The reason why I'm emphasizing on this is that even though there is a chance that because of the cusp height and position you might fail that particular task, but you will still get a good score. So you will have a close fail, or you won't fail the task badly. So once you don't fail it badly, your other two tasks for that particular cluster, for example in restoration you have other two tasks as well, so the score for your other two tasks might compensate for your bad performance in one of the tasks in the cluster. So this is very important. This is what we tell the candidates, that even if you perform badly in a particular station on the clinical skills day or a particular task on the technical skills day, make sure that you don't fail it badly. Because if you are a close fail, then your good performance in the other station, other task can compensate for the bad performance in one of the particular task or station of the cluster. All right. So yeah, basically 7 clusters, 5 in the clinical skills day and 2 in the technical skills day. You need to pass all the 7 clusters in one sitting of the exam. Okay. If you fail the clinical skills day, one of the cluster out of 7, you will fail the entire exam and you have to give the entire exam again. All right. So yeah, basically this is how the assessment process works. All right. And it is very important, as we are very strict even at the academy, all our online courses, the written exam, practical exam, we are very strict with the marking rubrics. The reason why we are strict with that is that ADC assesses your task based on those rubrics. So why don't you practice? Why don't you prepare yourself according to the marking rubrics itself? Because these are the points on which you will be judged. It's not about how good your task looks. It's not about how good your English is during the communication OSCEs. These points don't matter. The things that matter are mentioned in the marking rubrics, and that is what you need to achieve in order to get a good score in each session, each task of the practical exam, and clear the practical exam as a whole. All right. Thank you.